to one of the presenters and a couple people from the Western Hemisphere. My name is Lenny Ryan. I'm co-chair of the Capacity Development Committee of Research for Life. A couple of years ago, we started having webinars because we had underutilized resources, but it's really morphed into many other things now. So we're very happy to have this one on systematic reviews. We will record the video and have the PowerPoint presentations. They'll be available on the Research for Life training webinars page, and you'll be notified when they're available. Okay, so if you have a bad connection at some point or you want a copy of the PowerPoint, you'll be able to do that. In chat, we're going to have we have a question going on. Okay, in chat, we would like people to list what they're hoping to learn, so the two presenters can have a quick look at that. So I know a lot of you have put messages in saying where you're from, but if you can put in a sentence about what you'd like to learn, that would be helpful. Okay, and at the end, we'll ask you to list one thing that you learned. We plan to have at least 15 minutes at the end for questions and answers. Most of the questions and answers should be put in the Q&A section, not in the chat. The chat is more for our general introducing, or if I have a comment to add about something. But put your questions in the question and answer section, and we'll go over that near the end. I want to thank ITOCA, of course, for this ITOCA staff for the logistics, the registration, the email messages, and the technical aspects. And you can see that two people from ITOCA, Research for Life, and Monica are monitoring. Chesdia came on too, so we have three people helping us, making sure that this runs smoothly. Our two presenters are Tandi Lwoga, Professor and Acting Rector of the College of Business Education, Tanzania, Business Education. She has published more than 100 publications in leading international journals, conference proceedings, books in areas of informatics, indigenous knowledge, and knowledge management. She's published 4 systematic reviews, serves on a working group to update the guide to information retrieval for Campbell Systematic Reviews, and provides guidance in conducting systematic reviews to students and faculties. She has taken a lead in facilitating a number of professional training programs to research scientists in Tanzania, Kenya, Uganda, Ethiopia, Sudan, Mozambique, and other sub-Saharan African countries on these topics. Excuse me, research methods, Research for Life programs, scientific writing, systematic reviews, and meta-analysis. So we have a very experienced and knowledgeable person for one, and the other one is Irena Bond, Associate Professor and Library Manager at the Blaise Library of Massachusetts College of Pharmacy and Health Sciences in the US. She's the liaison to pharmacy, acupuncture, and graduate programs. She has previous experience with designing evidence-based medicine and other Hinari Research for Life training. She's published 1 systematic review, served as a second reviewer on a team of systematic reviewers, and provides guidance in conducting systematic reviews to students and faculty. So her background is, I think both are primarily started out in health, but we're going to try to expand this into other disciplines because the tools are applicable. At this point, I think that Tandi is the first presenter, so I will turn it over to her. Thank you very much.
Yeah, thank you, Lenny. Hi, everyone. So as I've just been introduced, I'm based in Tanzania. I'm Tandi Lwoga, and I'm just going to introduce. And my colleague Irena will take you through the key steps of the systematic review, and then I'll come back later to just demonstrate how you can use the Research for Life portal to gain access to the literature when you are doing your systematic review. What is a systematic review? I'm sure this is just, some of you might have asked yourself. So this is just a scientific investigation that focuses on a specific question and uses scientific procedures on how to identify, select, assess, and summarize the evidence from other separate studies. So it's completely different from a literature review that we know, where you can just review 2 or 3 articles and come up with a paper. But with a systematic review, you really need to have a question that is very focused, that you will use to identify literature, select them, screen them, and then summarize evidence from different separate studies. So what are the key features of systematic review? First, as I said before, you need to have a research question, just like that picture you are seeing, where you have a lot of studies, but a question will really help you to focus in order to search and then gain access to the literature that will help you to answer to that research question. And then you need to have a systematic search procedure on how you will search all this available literature that will help you to inform your research question. And after you have searched, you also need to have predefined eligibility criteria. So usually this criteria will help you to screen through and see what to include and what to exclude based on what you have got from your search. And usually before you embark on a journey to search literature, you need to register a protocol. So my colleague Irena will talk more about the protocol. And then another key feature of the systematic review, you need to assess the validity of the searched evidence. You need to assess the methodology strong enough to help you inform, to provide answers to your research question. What about the quality of the evidence in terms of the methodology? So you also need to assess the validity, and then you need to synthesize the evidence and come up with the results for presentation, but as also for writing the manuscript. And the whole process, it has to be very transparent. So that if someone else has to do that systematic review, they can repeat the method. So one of the key features also, it has to be reproducible. So everything you do all the key steps, you need to report them transparently so that it can be reproducible. So I'm sure you have heard about meta-analysis. So you can have a systematic review, as I've talked about, and you can have a systematic review with meta-analysis. So usual meta-analysis is a statistical strategy that will help you to analyze your data quantitatively. So if you have searched your data and you have analyzed qualitatively, then it can be in a systematic review that you have synthesized and evidence narratively. But if you apply quantitative methods to analyze your evidence, then it becomes a meta-analysis. So usually meta-analysis, we say, is a statistical procedure, as I've explained, that can help you to combine results from a number of different reports into a single, to create a more single and more precise estimate of an effect. And it's very important, if you are to do a meta-analysis, to consult a statistician so that he can help you throughout the way, when you create, from the way you created the research question and throughout the journey, as we'll be speaking about it later. So systematic review is been very common in clinical medicine or in health sciences in general. As you can see in that study, you can go and retrieve it. So it started way back, but now we are seeing systematic review questions and papers that are being published in other disciplines like education, also agriculture, natural resource management, but we're also seeing a lot of studies in nutritional studies and many other studies, even in social sciences. Systematic reviews are becoming very common. So because systematic reviews started in clinical medicine or in health sciences, you find a lot of systematic reviews, but also a lot of tools and guidelines that can help you, but most of them might be in the health sciences, or even a lot of databases might be based in health sciences, but we are also seeing more development of many tools in other disciplines. So why should one want to do a systematic review? So there are many ways. First, you may want to summarize evidence, you may want to inform your decision, or to secure a grant funding, or you want to establish the feasibility of an intervention, especially in clinical medicine. You want to assess the efficacy of a certain therapy, if it works, or an intervention then systematic review is one that can help you to have a feasible result to help inform your research question. So when we talk about systematic review, there are different types of methodologies when we talk about reviews, as you can see them. But we say the systematic review is the one that have high quality of evidence or confidence as compared to other types like narrative review, which could be just like a literature review. But the more as you go up the ladder to a full systematic review and meta-analysis, that's when your confidence and your level of evidence, the quality is very high. So I'll just explain briefly some of them. So I'm sure you have come across a paper where it's written mapping review or systematic map. So when we talk about mapping review, we usually use it to map or categorize existing evidence. So maybe you want to, your mainly outcome will be to assess the quantity and quality of the literature, and you might use mapping review. Maybe you want to map your evidence according to different locations or different countries or different regions. You might want to do a mapping review. But if your research question, you want to inform evidence and you don't have time to do that, you might opt to do a rapid review. So rapid review, usually you can do it in 3 months and you can have timely access to your evidence. And so for you to do a rapid review, you need to shorten your, to narrow the number of databases maybe you might want to consider, because if you want to do a systematic review, you need to consider all available databases. But for a rapid review, you might consider 2 or 3 databases so that you can finish your rapid review on time. And then we have scoping review. So if your aim is to assess the potential size and scope of available evidence, then you might opt to do a scoping review. And this will help you to characterize quantity and quality of the literature. So I'll just provide some examples. For example, you see that the first research question, this paper, they wanted to know what are the predictive techniques in diabetes self-management. So you can see in this paper, they wanted to map, to categorize evidence that of different techniques that can help for diabetes self-management. So the research question can be like that. For example, if you want to do a rapid review, as I said, maybe it's the technology is very recent, you just want to map out and come up with quick evidence, or you want to inform the police decisions for policymakers, then you might opt for a rapid review. And that is just an example. What is the impact of ChatGPT on education? As we know, ChatGPT is one of the recent technologies, so you want to come up with a paper within 3 months, then you can opt to do a rapid review. Another example for a scoping review, it could be you want to know the potential size and scope of the existing evidence. So for example, like that systematic review, they wanted to assess the impact of ruminant feed interventions on livelihood among small-scale and agro-pastoral livestock keepers in low and middle income countries in Africa, Asia, and Latin America. So for them, they wanted to know different types of interventions that are used by ruminants and see how they can help to improve livelihood of the small-scale livestock keepers. So they wanted to know what is existing and how is it being used. So they wanted to know the quality and quantity of the evidence. So usually your research question is what will inform you to know what type of review you should opt. And then we have systematic review. So usually when you want to do a systematic review, it's often you want to provide answers to a question and you want to assess whether intervention X works to a specific type of a population. So usually here you don't have different types of interventions. You want to assess a specific intervention and see how it works. And here you might also narrow down and focus to a specific type of study design. So it could be maybe a randomized controlled trial or experimental research. So this is unlike to scoping review. Scoping review, you have different types of interventions and you might focus to different types of study designs. So systematic review is very specific. You should also assess the quality of evidence or risk of bias, and it might also include meta-analysis. So an example I've given there, in this study, they wanted to assess the effectiveness of as a director indica, which is a name tree, on prevention and treatment of clinical human malaria. So they wanted to know the effectiveness of this plant for preventing and treating malaria. So that was a specific type of intervention, and they wanted to see the outcome in terms of how is it being used to prevent and treat human malaria. So if you want to be very specific, then you might opt for systematic review, and usually this can be done for 6 months or a year, while rapid review can be within 3 months, but systematic review and mapping review or scoping review usually is 6 months or 1 year, depending on the time that you should put as a team. So other types, in a nutshell, you might want to do also critical review. So when we say critical review, your aim maybe is to provide a more detailed and balanced discussion and evaluation of the strengths, weaknesses, and notable features that is existing within the literature. But you also want to analyze if there are any contradictory views, then you might want to do a critical review. But if your aim is to summarize existing evidence from existing systematic reviews or reviews that are available, then you might go to a higher level and then opt for umbrella review, or sometimes it's called review of systematic reviews. But if your aim is to have a realistic review that focuses on understanding and unpacking the mechanism by which an intervention works, then you might do a realistic reviews. So as I've said, there are different types of reviews, but usually you decide to do a specific type of review depending on the research question and your aim, or what you want to find out. Okay, so I've just attached this paper. The materials will be circulated later. So you can also go and look. There are like 14 types of review types. You can also look in that article and gain more knowledge about the different associated methodologies when we talk about reviews. So I'll talk briefly about the guidelines, because it's very, very important before you embark on a systematic review. It's very important to understand reporting guidelines, because these guidelines, they have list of items that you can use in the way you conduct your systematic review and the way you report, the way you write your manuscript based on the systematic review. So before you select, because there are different types of reporting guidelines out there, first you need to know the discipline, because there are some guidelines that are very specific to health or to education or to environment. So you need to know what is your discipline, what the research question, in which discipline are you focusing at? And then also the population. Are you focusing to general population or to children or to women? So it depends. So all these issues will help you to select a specific reporting guideline. And then you also need to look at the journal requirement. So because usually, basically, when you do a systematic review, one of the aims is also to publish a paper. So it's very, very important to also select the journal much earlier and then look at the requirement. That will also help you to know what type of reporting guidelines should you embark on, because some journals, they want you to follow a specific guideline. And then if you belong to any network, you want to belong to any network, for example, Campbell or Cochrane, then they might also guide you what type of guideline they want you to use. So some of the guidelines that I've put, but there are more than this. One of the common one in health sciences, if you are systematic review is focusing on health sciences, you might also use Cochrane. So usually they provide reporting guidelines on how to conduct and report systematic reviews in health. And usually they focus on systematic reviews for clinical trials and randomized control trials. But if you are in the social sciences discipline, you might want to use guidelines from the Campbell collaborations, where they provide different tools, guidelines on how to conduct a systematic review and how to write a manuscript. But we also have Prisma. This is also very common in health, but also researchers from different disciplines, they can use Prisma. I find it very useful. And then we also have another one from environmental evidence, and this is for researchers in environmental science. So you can go online and then check on their website, and then you'll get more access to their guidelines. So at this stage, I'll now invite Irena to proceed with the key steps for systematic reviews. Thank you, Lenny. Lenny, back you, or Irena, you can proceed.
Yeah, just getting my slides ready. Hi, everyone. Thank you so much for joining today. It's a pleasure to be here with all of you from all over the world. Again, my name is Irena Bond. I have interest in and some experience in conducting systematic reviews. A few years ago, I knew how to do a systematic search as a librarian and what databases are available for specific topics, but I had no idea what are all the steps involved in properly conducting a systematic review. And one of the best way that I would recommend, even after this session, is to join a team with a where the principal investigator or some of the researchers on the team have some experience with conducting systematic reviews, because it's not that easy to be done. Having said that, there are steps that are outlined in my presentation to help you with the process of conducting systematic reviews. And there's also a lot of free available resources that Tandi mentioned and more that are available for you to use as well. So my goals for today was really to provide this step-by-step approach of how to conduct proper systematic review. And these are for beginners or junior researchers. If you have more experience with that, feel free to mention it. I also want to link you to those widely used international templates, checklists, guidelines that are used today in conducting systematic reviews. In my bibliography and throughout my presentation, I will refer a lot to specifically to one paper, and there is more than one that I list in my bibliography at the end, but at least one of them is all the steps I've taken from most of them from this paper. So I am going to mention the steps here. I will give you some details about each step. But most of the details you will find in that paper, which I will point at the end of the presentation again. It is an open access paper, so everybody should be able to access it online. And you will also, in that paper, find all of the links to all the templates that I'm going to mention. And some of them I will not mention. I will just say they are there. Because they are included there with more examples and also including different types of resources and disciplines. So with that said, I also just want to add a little bit, since Tandi mentioned what is a systematic review. All I want to say here is in this slide that there is a systematic method in the way the review is conducted, searched, or processed. And it shows that there's a plan. So I've underlined systematic, and there's a plan, initial plan before starting the systematic review, which is opposite to unsystematic narrative review. Why systematic reviews have become more and more important? Because there is a lot of studies being published in all sorts of fields. And my specific expertise is more in health. So it's hard to do clinical medicine. It's more complex. So as other fields become more complex, when we try to use the current research in our daily practice, it's hard to stay up to date with all of the information published. So having also a lot of studies are very different. They're different in their design, how they approach a certain problem, how they solve it, what kind of results they get. So it's very hard to generalize what is the best evidence out there. So by using a systematic review, we will stay up to date with current trends in our fields and be informed quicker. Also, understanding the steps of systematic review and how to conduct it is important. As I mentioned, it's not easy to be done. So having an overall understanding of what they are and actually practicing it is very important. Before I show you the next very busy slide about all the steps that are involved, I want to say that all of the steps that we're going to mention, ideally, at least 2 or 3 reviewers will be involved in each of the steps in order to ensure data quality and accuracy. And so I won't mention that as I keep going through the individual steps, but just keep in mind that every one of those steps, you would need at least 2, if not 3 reviewers to be involved, and sometimes independently involved in those. So this is a very busy slide, which I listed it here because the next slide is a flow chart or a flow diagram. I wasn't sure if you can see it on the flow chart through the Zoom, so I listed them here. And then I will go to the next slide to show you how the flow chart looks like, which is the same steps are involved here, but it's in the form of a flow chart. On my following slides, I will go through each one of the steps and will mention some additional details that are important to understand. So as you know, as researchers and maybe librarians, every research starts with a question, and the better the question, the better the outcome we will receive. So formulating the research question is the first step in starting a systematic review. Next is doing a preliminary search. And what that means is we first want to identify if someone else has done this research already. We don't want to duplicate these efforts and write the entire systematic review to find out that it's already been published. Or there might be a protocol already that somebody had published publicly that they're working on this topic. So you want to do that homework, preliminary search, to identify if there is any studies or are there any similar studies, or maybe there's a same study but it's old that you want to look at. So that's what's involved in the preliminary search. And then you would get a better idea of how you would focus your systematic review. Next step you will develop a search strategy. You will have to think about inclusion and exclusion criteria. And I'll go through all of that after. Develop a search strategy, select the databases. So this particular database is here that you see, PubMed, ISI, MRCT, and so forth. These may be very different, and the order of databases depends on your question and on the systematic review that you're conducting. So these resources may be different. This is just an example of how many there are. And here you would list the number of results that you got from each of these databases. Next, you would have to use a research manager to import all of the results into one library in order to remove duplicates and keep them in one database. Write a protocol, get approved by your supervisor, register it, think about the title and abstract screening of the articles first. Before you get to the full text, you would screen title and abstracts. Then you'll report the number of the selected title and abstract articles, and then go and look for the full text for them. There's also step 9 involves a manually searching, and we'll talk about what that means. Manual searching of articles, downloading full text and screening again, the entire full text, and then data extraction and quality assessment, checking, data checking and then doing the meta-analysis or the statistical analysis, and then another data checking, and then manuscript writing, revision, and submission. So in a nutshell, these are the steps that are involved in conducting a systematic review. And as I mentioned, each step needs to be performed by at least 2 or 3 reviewers. Okay, so starting with the research question, there is the most common, well, first of all, the research question should be something that's realistic, feasible, should be something that is of interest right now, unique, ethically designed, and relevant. It, of course, should be stated clearly. logically, and it should be well defined. It can be just like, what's the meaning of life? That's a very broad question that we can talk with friends, but when it comes to designing a research question, we want to look at for specifics. So one framework that's being used that you might be familiar, it's called the Pico Framework, which stands for patient or population, intervention, comparison, and outcome. This is used a lot in medicine, and especially for systematic reviews of clinical trial study designs. So depending on our question, this helps us formulate our question. And I will give you an example on the next slide. Sometimes you don't necessarily have to fill in all the P, I, C, and O, like when you're doing an observational study, or then you might just have patient outcome or patient exposure and outcome if you didn't have an intervention. For example, if you wanted to see if some patients, pregnant patients who were exposed to certain medications or some sort of risk of harm, if they developed a certain outcome or if the fetus developed a certain outcome, this is a kind of a observational study that you might be asking for. So in this case, you would be using a different, not all of the elements of the question framework like Pico. There's also additional, maybe I think like 21 other types of frameworks that can help you define a question, a research question, and I've included a link in my bibliography to those additional questions. There is one called SPIDER for more qualitative and mixed methods studies that is more popular. And like I said, there's an additional 21 other varieties that if you follow that link in to the University of North Carolina research guide that is in my references at the end, you will be able to get to all of the list of all of these frameworks. Okay. So here is an example for, let's see, we wanted to find out whether the Ebola vaccine is safe and can induce sufficient immunogenicity to the subjects. This is our issue. From the issue, we stated in a question using the Pico format. If in this case, we don't have a population, as you can see, or a patient, it's pretty much everyone. So the question is, how is the safety and immunogenicity of Ebola vaccine in human? Or it could be stated slightly different, but basically the Pico in patients, we will have healthy subjects, human, and then the intervention is vaccination. The comparison is placebo or nothing. And then the outcomes is safety or adverse effects. We're interested. You can also state the question as in healthy human subjects, does vaccination compare to placebo? Is vaccination compared to placebo safe and effective, or does it have adverse effects? So you could the question can be stated in a different way as long as you keep the most important categories in the question, the P, the I, the C, and the O, in this case, for this example. And the reason we want to ask the question this way is so it's clear how we're going to search about it, and then so others can clearly understand what your research question is. This is the step 2, doing the preliminary research and the idea validation after you've stated your research question. Basically, that will involve a simple search in PubMed or Google Scholar with the terms Ebola and vaccine. So when you're doing a preliminary research, you're not getting too detailed with your search strategy. You just want to see how many studies roughly are out there. Is there enough to conduct a systematic review? What is the quality of the studies? You know, what kind of what are the studies available? So by doing that, you would later avoid, as I said, you want to also see if somebody else published it, so you don't duplicate your efforts. And let's say we did that search and we find a systematic review of determinant factors influencing antibody response from vaccination of Ebola vaccine in non-human primate and human. this paper seems relevant to us, and we probably want to read it to gain a deeper insight and understanding of the, our research question. And then we can still conduct our systematic review because we are only interested in a different population, only in human. So this is just illustration of how we do the preliminary research and why, to identify and gain understanding of our question, and to see how to write about something that is relevant, but it's not written yet. Next step would be to decide on the scope of our systematic review. So we do that by selecting inclusion and the eligibility criteria, or also called inclusion and exclusion criteria. So this is again tightly close to our Pico question, the study design and the date. So usually, so for exclusion criteria, for example, we want to exclude anything that's unrelated to our question, anything that's duplicated, unavailable full texts, or abstract only papers. So we don't do systematic reviews from abstract only. And exclusion should be stated in advance. So in your protocol, in your plan, when you write later, you want to state explicitly what you've excluded and why. So you can stay away from our own biases. In the inclusion criteria, you would want to, again, closely stay to your Pico question and include articles with the targeted patients, investigated interventions, or the comparison between two studied interventions. If you had a comparison, like in my question, I didn't have a comparator. I just had the vaccine compared to placebo, so it's nothing. But if I was comparing certain vaccine to different vaccines, then I would have to compare the two. So in my inclusion criteria, I would have to specify that as well. So anything that contains information to answer your research question will be part of your inclusion criteria. Most importantly, there should be clear and sufficient information, including positive or negative, to answer the question. If you, whether it's positive or negative answers you find, you have to include that as well. Here's an example with the Ebola, our Ebola example. So for inclusion criteria, we want to include any clinical trial evaluating the safety of Ebola vaccine. As you can see, I'm not including other study designs in this case. I'm not looking at case studies. I'm not looking at cohort studies. I'm not looking at observational studies, etc. I'm including only, and that's, your team will decide what's the best study design that you would like to include. In this case, my question is about intervention. And we know that in order to find the best available evidence for intervention questions, we need to look for clinical trials and well-designed clinical trials. So I'm only including clinical trials here. I'm also not restricting it geographically to a country, to a patient's age, race, gender, publication language, and date. So by setting this inclusion criteria and clearly specifying it in your protocol and in your systematic review, you define the scope of your work. And as exclusion criteria, I am not including non-human subjects or in vitro studies. Studies also with data that are not reliably extracted, duplicated, or overlapping data also will not be included. Abstract-only papers as preceding papers, conference, editorial, and author response theses and books are not included. Articles without full text are not included. And again, case reports, case series, and systematic review studies are also not included. You can read other systematic review studies, but generally you do not cite systematic reviews again. You may see also others, but those are going to be excluded from your own systematic review. So the next step is to design a search strategy. I recommend that if you have to design one, you would consult with information professional or librarian, and they can help you there. Especially, I know librarians are happy to be part of the team and be included in the research. So definitely reach out to a librarian, include them in this, and you will have a solid, professional who would help you with later writing the methods, the search methods in your systematic reviews. They will design your search strategy, keep track of your research management system, etc. So what you do first is design a standard search strategy in PubMed first. So it doesn't have to be very detailed. The standard search strategy are usually your Pico terms and the study design. After that, you would design a more detailed PubMed search strategy, and then you will take that search strategy and translate it into other databases to get them into their own strengths and weaknesses. Consider those to get the best results from those. So again, the basic search strategy is built on the research question, the PICOs, the elements of the PICO. Usually that includes free text terms. Sometimes and often they are in the title and abstract fields only, and it could include any other appropriate subject in the MESH fields. MESH stands for medical subject headings. If you're not familiar, those are in large databases such as PubMed. Those subjects are being used to index articles. And when you go there, you can use those subjects to gather many articles that are indexed with the subjects that cover that concept. And I'll demonstrate briefly in PubMed where they are and how they look. Outcomes terms generally are not searched for. Sometimes they are searched, but generally they're not searched for because they're not also obviously mentioned in the articles. There are sometimes, for example, if the outcome is to see if somebody can quit smoking, the outcome is smoking cessation. It could be. You could search for that, but generally they're not searched for, even though you have them listed in the Pico. As you go along and doing the original search strategy, you could improve the search strategy as well and the search each time you retrieve new papers. And then again, a detailed search strategy for each database is developed next. Often, a team identifies a few key articles in the topic, and it's a good idea to read those articles first and look at their terminology and see, identify some key terms from there as well. And then use those to develop the standard search strategy first before you translate it into, PubMed and then other databases. So for example, here, the final general search strategy for PubMed, and it could be more, this is an example, it could be slightly different, but this in general, this is what it entails. So you can see that in parentheses, I have my first concept, Ebola, and all synonyms connected with or, which they are synonyms and related to my Ebola concept. So that's why I'm using or. And then in the next parenthesis, I have the second term, which is my intervention, again, connected with or. And then the last one is the study design. Again, I keep those in parentheses separately and combine them with and at the end here. Because the study of these topics is limited, we do not include outcome terms, safety, and immunogenicity generally in the search term to capture more studies. So you can later identify that into the texts that you retrieve. So I wanted to go to PubMed. And let me just go there to show you. So for PubMed, you would need to go, I believe you need to go through your Research for Life resources in order to gain full text. Tandi, is that correct?
Yes.
Yes,
Okay.
that is correct.
For life, yes.
You
Go
go
to
to
the-
you go in Research for Life, you go to the databases and you click on PubMed, and that'll give you the links of what's available through the program. But there's also a generic version.
Okay. Thank you. I am going to go directly to PubMed on the web, but as Lenny and Tandi said, you would go through your Research for Life program, so you can access the full text from there. This is PubMed, their main page. You can see 35 million citations. So searching in this database usually would be great to use mesh terms combination, like I said before, combination of mesh terms and text words or free text words, keywords also referred. Generally we want to go to the advanced search. And when we're designing systematic review, I can copy and paste what I had in my let me go back to this to copy it to show you after you've designed it. Okay, and I can paste my search here. Not sure what those are. Okay, and then click search. If I go back to the advanced search and scroll down, I can see my query and I can see the number of results. If I wanted to see how PubMed actually did the whole search, I can click on details and get the entire search history, how PubMed automatically did the search for me. And you can see that it also included terms that I hadn't initially didn't think of or didn't put in my search. So PubMed had improved drastically in this way that it automatically maps your results. If you wanted to do, if you didn't know how exactly you can construct that, I said, or you can do that individually by entering search terms here. And you would want to enter them one at a time, because if you wanted to use the automatic mapping of PubMed. You can also do title only in abstract search. Let's say you are retrieving a lot of results in your search becomes huge. You can see title and abstract here, and you can search individually each of these Ebola or Ebola virus or Ebola virus or Ebola virus disease, etc. And add them to the search box here. You can see how it automatically added the fields. And when you add them to the history, you can see that it retrieved, just for this term, for this concept, it retrieved that many results. If you wanted to enter your second term, your second concept, vaccine or vaccination or any other immunization, etc. You can again add them to the history. This will be your second term, and then you can combine by using manually these three dots here, if you can see them. If you click on them, you can add your search term to the query box, and then the next one with an and, because they're different to the query box, and then add to history. So these are my two terms without the study design. And if I wanted to do the study design, I can do clinical trial, add to history, and then do the same thing here, add to query with end. And this will be my final result here. Again, I did not type all of this, which PubMed did. So my results are much smaller. But if you wanted to see again the details, how it was searched, you can see. And this is the standard. Anytime you type clinical trial, this is how PubMed will add clinical trial publication type, clinical trial as topic, and clinical trial in all fields. And that's what I had in my search history initially. And from there, you would display the results here. And then within the Research for Life manager, you will have a full text somewhere here listed on the, I believe on the right side, or you will then go ahead and get the full text from here. Okay, so now let me go back to my presentation. New share. Okay. Okay. So one of the ways that we, I think Tandi mentioned Prisma flow diagram that is very well accepted in pretty much all discipline, is how you report your what you found in the databases. So you would have, this is the flow diagram, which is also linked in the paper that is at the end of my bibliography. You would list all of your databases. You would have them listed within each database. How many did you retrieve? How many did you identify that were relevant? You will put the number here, and then you'll put the total number of articles. And from there, how many you exported it, the name of the research manager, in this case is EndNote, and the version. How many duplicates were excluded, numbers as well. How many articles did you select to screen? Out of 1785, you selected 895, or your team, and you excluded that many numbers. Full text articles assessed for eligibility. So out of this 895, you selected 232 to see if they're eligible. And then you excluded 213 out of this, out of 232. So you excluded them because 71 were irrelevant. You have to give them reasons. 54 were duplicates and 88 had no full text. Next step will be from those 13 that you've identified as eligible for your systematic review, you will then do a manual search. And I think I'm going to the next step. It will show you what manual searching is. And then you will identify additional articles, 32, that you will screen and you will analyze qualitatively, and then quantitative synthesis. So these are the articles you will include at the end. 32 qualitative and 29 quantitative. Those are the ones included in your review. These were eligible, and so forth. So this is very standard practice nowadays. I believe more and more this is being used in the way, and it's actually required that you have in some publication that you have a Prisma flowchart submitted as part of the publication. Okay. Next step will be to search other databases, not just PubMed, and import all the results from all the databases to a library in a research manager, Mendeley or Zotero or EndNote or RefWorks. And then from that library, export an Excel sheet. They have, each one of those research manager has the opportunity to export to an Excel sheet. These are guidelines. I don't know what they stand for, but they require that at least 2 databases you search in order to have a systematic review. So if you search just one database, you cannot call it a systematic review, but at least 2. However, the more databases you search, the more accurate and comprehensive your results are. And again, I mentioned that what database you choose and in which order you're going to search them depends on your topic, your question, and the type of study that you will include, whether it's clinical trials only. So if it was clinical trials only, you would most likely have to use Cochrane, the MRCTS, or International Clinical Trial Registry Platform. For this case, there's 14 databases that are suggested. And you can see some of them. Not everybody has access to all of them, but you can see that I know you have access to Scopus, PubMed, Google Scholars available, Cochrane probably. Clinicaltrials.gov is free. This one is free too. And then Popline, Population Line, I'm not sure for that one. And then the last one includes gray literature. So another aspect of systematic reviews is when you're looking for all the information available to find that relates to your question, often you would want to consider gray literature. And what gray literature is literature that is not officially published in a publisher, but it's available on the internet. Either it's a report or some study that was done, but it wasn't published in a regular traditional way of publication. So, or maybe a website or a society that publishes a report, then that kind of information, it may also be useful for the evidence that you're combining. And you can search that on the web anywhere, but also this Siegel also contains gray literature only. And in some systematic reviews, they are reported separately. So I did not include, and in the paper that I'm linking, it doesn't talk about gray literature, but often I've seen it reported separately with a separate Prisma, with a separate everything. But you can specify that in your protocol, how you want to handle that. And finally, all records are collected onto a reference manager, library, deleted duplicates, and then exported the records into Excel sheet with essential information for screening. So it doesn't have to have everything, and it depends on you. And there are some standard ones that you can use. What kind of information you want to export from each article record. So when it comes to searching Google Scholar also for additional information, you can use Google Scholar Advanced Search to search for this. So for example, let me share my Google to show you here. Share. Okay, so Google. So in Google Scholar, you see this tab on the side. If you click on it, you can go to the advanced search. So select the advanced search. And here is where you can select find articles with all of the words. So you can type all the words, or you can just say, Ebola virus, or just Ebola even, to be more inclusive. And then with at least one of the words, you can list here vaccine, vaccination, immunization, etc. Oops, sorry. Advanced search. And where the words occur on the web, you might want to use only in the title because it's much larger than what we're searching. And then search right here. So that will retrieve this search up here, and you would record that as well in your searches if you're using Google Scholar as one of your resources. You can also export from here into a research manager, which you can also set from settings right here. You can set it to EndNote or BibTeX, or if you're using Zotero and Mendeley, you can just grab it from the screen. So you can export from here directly into your library, into your research manager. And let me go back now to this presentation. New share. Okay, so the next step is to develop a protocol and to register it. Why is that important? Because protocols are important to, before you even do the whole study or the whole systematic review, it's important to register your protocol, to describe the rationale, how you're going to conduct the studies, things like what criteria you'll use to screen the literature, how you will search for the literature, what quality assessment tools you will choose. And that will guarantee transparency in the research process. You can get feedback from other researchers, and you can also kind of say that I'm doing that, and if somebody else searches that, they will see that you're already working on it, and they won't publish the same review as you. So it protects from duplication. It is considered also documented proof of team plan of action. Remember, I mentioned that having a plan is important for systematic reviews, and you have a pre-analysis plan as well. Also, the whole team should send your protocol before you publish it to whoever will be the principal investigator or the primary author that's going to be the first author of this paper or the study, to revise it and then upload it to registry sites. So there are many registry sites, as Tandi mentioned as well, by subject and by discipline. Here is one of them. So she mentioned Cochrane and Campbell. I put here Prospero is recommended as it easier. I haven't used it myself, but in the paper said it was easier. I put a link here. And there is a protocol template in the paper again that will show you what are the things that are needed in that registration. Next, after you've registered your protocol, you then will go in your research manager and you'll identify some of the titles or some of the articles that you want to screen. And how are you going to screen them? Based on your eligibility criteria that you decide, the inclusion and exclusion in the beginning of the process. When you're in doubt or the team is in doubt whether you should include something or not, the general rule is include it if you're in doubt. And then if you exclude something, like I said, keep note how many records are you excluding and give it the reason why, because you would need to report that in the Prisma pyramid. Next step is you will download full text. You can attach full text into your records in the EndNote or the research manager you're using, and then you're ready to start screening full text. To get the full text, you can go to Research for Life resources. Many search engines may provide you for free text to full text articles. You can also, if you've used ResearchGate, you can contact individual authors. And in some papers, the authors' personal emails may be listed and you can contact them and they can provide you with a free copy. Again, contact your librarian. There are other options for interlibrary loan that they can identify for you, or suggest something that you may not be aware. It's important to keep that connection good. And next, it's time to do a manual search. So this includes searching reference lists from included studies for the review. So you would look at the reference list of all the articles that you're considering. You can contact the authors and the experts. You can look at cited articles in PubMed and Google Scholar. That means which articles had cited the articles that you chose. Let's say you ended up with 30 articles that you're going to include in your systematic reviews. You want to see what other articles have cited that article. This is called citation tracking, tracking all the articles that cite each one of the included articles. And that's a very long process. And again, librarian can help you with that. Again, if librarian is helping you with the systematic review, make sure to include them as equal part of the team, as well as in the publication. And that will be just fair to do. Then look at also relevant articles or similar articles. I mean, even PubMed does that. You can see when you find one article, it says see relevant or see similar articles. So you want to find out what are some of the similar articles. So all the possible relevant articles must undergo additional scrutiny against the inclusion criteria after following the same records yielded from electronic databases. So you do the same kind of evaluation like you did for the other articles that were not manually searched. And generally, each reviewer has it's up to you how you want to do it, but in this particular paper, they describe it. You have a tag or some color that you review, how you compiled all the results at the end of the comparison, for comparisons of differences in the discussion. So every reviewer will be identified why did they selected this particular article. And then you also need to state the number of the manually searched identified articles. As we saw in Prisma, there was a manually identified articles through citation searching, and that number is also identified or in the Prisma flowchart. And you finally are ready to extract data and quality assess it. So you start with the full text. So we saw that based on the final, which articles you're going to include, you want to download the full text to read them independently, as each reviewer would read them. And then there will be a structured extraction Excel sheet that is also available through the paper that I have. And there's many examples that, or you could develop your own, depending on what kind of information you want to put. Generally, that's in the graphs, you will have something, something like patient characteristics, outcomes, and then quality assessment. Those are the general classified fields in the Excel sheet. Often, the data presented in the graphs is extracted by software tools. I did not have that experience myself, but often a lot of people who do a lot more systematic reviews use software tools that are free. One of them is WebPlot Digitizer, and there's more than that. Or you can do it manually as well, depending on how big of a systematic review that is. In the Ebola example, for example, we would want to have the following fields in that structured Excel sheet. Usually the name of the authors and the year usually may go with the author field there. Country of patients, year of publication, study design, what kind of study design it is, the sample size that was included in that study, the point of infection and the time with Ebola, follow-up after vaccination time, efficacy, safety, adverse effects after vaccination, and Q&A sheet. So you can see that this is very specific to my question. So if your question was in a different field or in a different topic, you would have a different fields here. But generally, this will be the characteristics of, in this case, patient or whatever the subjects, the study subjects, then the outcomes, and then the quality assessment. Again, to evaluate, when you're using this, when you start evaluating the articles, each reviewer have to review these 14 items that I mentioned in the Ebola example independently, so to avoid bias. So, for example, for every if for example something is identified in the article, it will get yes, no, or not applicable, and that will be part of what kind of protocol you would like to use or which quality assessment tool you want to use. And like I said, there are many of them depending on your discipline. But let's say the general thing is you would assign positive or negative and not applicable, and for every positive you will rate it with 1, for negative and unapplicable 0, and then this will give you an idea overall for the paper if it's poor, fair, or good. So if you rate the paper between 0 and 5 at the end, then that's considered poor. 6 to 9 fair, and 10 to 14 is good. This 14 is because I have 14 categories here in the sheet. That's why I have 10 to 14. But your scores may be slightly different, and it depends how you are going to, with the team, going to decide how to quality assess it. Again, the quality assessment tools, like I mentioned, are many, and they generally has to do with the relevance, reliability, validity, and applicability of the study that you're reading. And again, in paper that I've listed as a reference number 1, you will find additional tools that you could use, as well as this particular one, and read more about it. Next, you would data check. Sometimes people may extract, if there's 3 reviewers that are extracting the data, there might be mistakes in the graphs. Sometimes maybe the software is extracting it differently. So you want to data check all the data that you're extracting, that it's correct to the original. And sometimes people take pictures also and put them into the sheet, so it can show how it looks originally in the paper. Next, it will be the meta-analysis or the statistical analysis that you're going to perform. And again, investigators use different methods. It very much depends on what kind of study you're doing, what discipline, and what kind of review you're doing as well. Again, in that paper, you will find a lot of free tools, as well as one of them is RevMan that people use. It's freely available software that you can download and use it. There's also cleaning of the data involved if you're going to use any tool like this. So the database or the software can extract the data effectively. The data needs to be prepared or cleaned for work with that particular software. And so the analysis consists of primarily 2 types, either qualitative and quantitative analysis. Qualitative analysis mostly describes the data in the systematic reviews, while quantitative analysis consists of 2 main types: meta-analysis and network meta-analysis. That's again in paper number 1. You can see more information on that. And I mentioned these steps. These steps are general that I'm talking about in systematic reviews. There are more detailed steps depending on your question or what kind of studies you're finding. You might find that there's additional steps as well. At the end, yeah.
Irena, we're kind of running out of time, and I know Tandi has some more comments, and we have to do Q&A. So could you at least go to your bibliography?
Yes. So this is the manuscript writing. That was the final one. You can read about it. And this is my references. This is the paper I referred. And like I said, this one is free and online open. This also, you can find the additional type of Pico and Spider and other questions, as well as this one. And over here is where you would find also a self-paced course that is designed by Campbell and available through Carnegie Mellon online that you can additionally take if you'd like to. And it's more on social sciences that you can take here. And this is a site designed by students for students, but more advanced students on best available evidence, searching, all of the concept I said in a very lay language, which may be of interest. And that is all from me. Thank you so much.
Thank you.
Thank you.
Hello, Tandi, are you able to come back on, and you want to talk a little about Research for Life resources, and then maybe we'll even go over a bit and do some questions. I've been trying to answer some of them, but some of them for the experts, for you two.
Thank you, Lenny. I'll demonstrate briefly on what is available on the Research for Life program. So once you log into the Research for Life programs, you will have contents, collections, and help, but you can search on the Research for Life to access the evidence, so you can go to the advanced search using the salmon. But to access the databases that Irena was talking about, you can go to the contents and then you go to databases. And then from there, then you will be able to access the databases that can help you for your systematic review. So as Irena mentioned, some of the key databases that you might want to consider for across different disciplines is Corpus and Web of Science, but other databases are very specific to specific discipline. The way it's not going through, but if you go to the databases, you'll be able to see different databases like PubMed and and different databases that you can use. Maybe at this point, Lena, invite questions since we have a few minutes left.
Yes,
And there are many questions that I've tried to respond online. So should we go through the is muted? Maybe
yes.
perhaps.
Okay, so we have how to search open access resources. Irena, you want to talk about that for a moment or two?
Sure. So a lot of open access resources are included in PubMed through PubMed Central and other places. You can also search the directory of open access journals, which is DOAJ, which includes high level of non-predatory or very good open access journals. And there are other ones that can say they're open access on the web. If you just search in Google and type open access resources and your topic, it may come up as well.
Okay, did we cover how to develop research questions on systematic reviews?
I think so.
I think so. I think we're all right there.
Okay. Yeah.
Yeah, so use the Pico and practice with the question, write them down, and then review in the bibliography those additional non-Pico or additional frameworks, they're called in that specific resource, that you can use to design a question.
Okay, now we've covered kind of that some will be licenses that you can get through Research for Life, and others may be more restrictive. So it depends. Some material is available and some isn't. You have to sort out what tools you want to use. So that's kind of a complicated question to answer. Let's go on. Please see, would there be a platform for mentorship? I think that if you go into some of the resources that Irena mentioned, there are groups in there, like the student one, the advanced student one. So you could get some, start collaborating with them and get help from these specific groups. So I would look at the resources she listed. Okay.
And another thing is, like I mentioned, if you can identify other researchers and reach out to them, just say that are already experts in that or have done systematic reviews, just say, I'm interested and this is my expertise. Is there anything, are you looking for something? You can also reach out to people that may be able to help you with that.
Yeah, it's a good one about if someone registers a protocol but does not go ahead, how can I know? How long can I wait? That's a tricky one.
Good question. I guess it depends. It depends on the registry that you use. I'm sure they have a way to require you to submit it after a certain period of time, and then it's probably a different period of time for every different registry. The best way is to contact the authors, and I'm sure their names are there, and just ask them.
Okay, we have explain inclusion and exclusion criteria. Do you want to go over that quickly again?
Sure. So inclusion means what articles are you going to include and why? And what are you going to exclude? Generally, you want to include anything that's in your Pico, that kind of information, as well as the study designs that you're going to collect. Like if it's clinical trials, you would say, these are my inclusion criteria. I'm going to look at for articles that cover Ebola in humans, and anything that has to do with vaccination and immunization, and it shows how it works, if it helps. So those are the inclusion criteria. But exclusion criteria, it will be anything that is not a clinical trial, anything that is in animals, anything that does not include your peak, or anything that didn't have full text, I won't include.
Okay, the professor, the UNC article is mentioned in the bibliography, and we'll make sure everyone gets that. Okay.
So the NUC and North Carolina NCU, sorry, and North Carolina University
UNC.
is not a professor listed there. It is a library research guide. So it's from their libraries. There is no name listed on the guide.
Okay, but there's lots of useful information there. Can systematic review be done individually? And I think you discouraged that.
Yes.
Is that correct?
Yeah.
All right.
Yeah.
I think we have a very good question after this. Do we go, and I have to slide up. Do we go ahead and do a systematic review on a subject that you find there is no literature on the subject matter? What would you recommend?
Not. Yeah, so you have to have enough, and enough could be defined differently. If it's a new topic, and like COVID, when COVID was new, there was no initial systematic reviews right away. But very soon, when everybody started publishing, systematic reviews started to come up. So you need to have studies on which to do a systematic review. You cannot do systematic reviews if there is not enough studies, because the whole purpose of systematic reviews is to combine studies on a particular specific topic, and then find what kind of, depending on the review, what kind of studies are available, or just what interventions are available for particular condition or situation. So the answer is no, you can't do, if there is not enough, you cannot do a systematic review.
So I'm going to ask a question, and it's for Tandi. Could you talk a little, because I've done some Google Scholar searches on environment and agriculture questions. Could you talk about applying this to other disciplines a little more, and what you have noticed in your searching?
So if I understand, he wanted to know if he can use Google Scholar to search for different disciplines. Yes, you can use Google Scholar to search, but usually in systematic review, we recommend using Google Scholar as a supplementary database, search engine. You start first with the credible and most structured databases like PubMed, Scopus, Research for Life, where you can gain access to a wide number of databases. And just to supplement, just to see if there are any additional findings, then you can go to Google Scholar. Because Google Scholar, you can search a wide number of literature, but its reliability is not, the algorithm is not known, because I can search now, maybe we can search together, maybe on HIV. I can get 5 articles and then someone else can get 100 articles. So usually we use it as a supplementary resource when we do systematic review. And remember, when I introduced systematic review, I said it has to be reproducible. So usually you have to start with the academic and structured databases, and then Google Scholar is the last resource. Okay,
but the point is that it is not limited to health anymore.
Yes, Google Scholar can search anything in every discipline, yes.
For example, if you were in agriculture, you would go into Agris, which is a very reliable database from Food and Agriculture Organization, and search there for systematic reviews about agriculture.
Yeah, can I show just one slide, Lenny, about the
database
in their disciplines?
Please.
Okay. Let me just go there quickly, because as we said, some disciplines, they have different databases. So for example, in health sciences, you might use PubMed, Cochrane, Research for Life, or You can also use Medline, Embase. So all those in red, they're also available in Research for Life, Sina Hill. And then for psychology, there's PsycInfo, but unfortunately it's not available on Research for Life. But education, we have ERIC, which is also open source, so you can use it. But other databases in black color, they're not available in Research for Life, but they're also credible databases like PsycInfo, EconLit, Education Administration Abstracts. Other disciplines that I've put, agriculture or life sciences, that means environmental sciences and all other related subjects. You can use CAB Abstract, which is also available on Research for Life, FTA, that is Food Science and Technology. You can also use the Environmental Index and also Research for Life programs. Other credible databases are like Agricola, Biosys, those ones are not available on Research for Life. For multidisciplinary and for any systematic review, you also need to combine the use of Scopus, which is also available in Research for Life. Web of Science, it's not there, but if you have access to it, it also increases credibility of your systematic review. Other databases, they are also they vary according to the region. For example, if your systematic review is focusing on Chinese medicine, you might want to include databases in that region. So I've put this Cochrane list of LMICs. So if you go there, you'll find a list of over 100 databases according to different disciplines, according to different regions. And all these, I've put them in red because they're also available, they're open source, but they're not very well structured as compared to the ones that I've put on the first slide. So all of them will be shared.
And this will be in your presentation so that people can look at these.
Yes.
Yes. So I mean, so once we get the presentation out, people will have more access to specific tools and how to get into them. What is the best research site which are recommended? I think we kind of covered that. And the best site for accessing ebooks. I know that Research for Life has a huge collection of ebooks. So if you have your username and password and go into Research for Life and do a sum and search, it will include books. So that is one way of getting at the ebooks. Here's a question for you two. Can systematic reviews be applied in thematic reviews?
Can you come back, Lenny?
Can I say it again?
Yes.
Can systematic review be applied in thematic review?
I don't know what it means, but systematic review is a scientific procedure of summarizing and combining evidence from different literature. So thematic review, I assume it could be like a literature review that you can do where you review 3 or 4 or 5. Yeah, but systematic review, you follow a more specified scientific procedure in the way you formulate your research question, you search evidence, and the way you combine and analyze the data. So these are 2 different types of reviews.
Yeah, I'm not very familiar with thematic review myself, but I quickly looked it up and it says that you would search in the data for themes. So instead of having individual studies, probably you will list the themes and then review the themes, go through the process, but it might be very similar to some of the steps. It's just instead of studies, you will have themes.
Okay.
That you've identified.
Irena, you mentioned this. Why do we not use abstract-only studies? So you may want to comment on that.
Yeah, so because the abstract is only limited in the number of words that are in there, it helps only to screen quickly if something may be relevant, but then the full text we have to read and it may or may not become more relevant when we read the details of the studies and everything. We need the more details if we're going to do a systematic review on the study.
Here's a good question. For how long is registration of the study valid? I know some studies in Cochrane are updated, and you'll see the note to that. Okay.
I think it depends on the registry. I'm not sure what each one of them says, but I'm familiar with the Cochrane ones. They're labeled as protocol, and then I don't know how long they stay until they publish the full review. They become full review after so they automatically list the review after that. But
Okay,
I'm not
what-
sure.
We have a citation to a Nature article. What are the basic measures to check reliability? I'm not sure exactly what that means.
So in that paper where I'm citing, I can pull it out and you can see there are tools for checklists for reliability, like looking at the question, looking at the what kind of data is being derived from there, if they're reliable, are there, so there is studies, there's checklists that you can go through and see that information.
Okay, at what point can we use JBI summary or covidence? Does that one make sense to you?
I'm sorry, I was looking for the checklist.
At what point can we use JBI summary or covidence? COVIDENCE.
I'm not familiar with that.
I know Confidence. Confidence is a tool that you can use to help you conduct a systematic review, like saving the literature, doing the screening, and then doing this, because I've used it once. But JPA summary, I've not used it. But I know Confidence is a tool to help you store the literature, but manage the literature, but also do the screening as well.
So it is a
Okay.
software.
It is a software.
Okay.
Yeah.
It's available
We'll
online.
kind of,
The team can
we'll
use.
do. I'm sorry, go ahead. Sorry.
Yeah, I'd finished. Yeah, you can go ahead, Lenny.
Okay, do we need to pay registration through different registry sites? Is there a fee for using the registry sites?
I'm not familiar, but I would assume so because you would probably have an account and upload things there.
Yeah. Okay. Let me get maybe two more interesting questions. Oh yeah, if a systematic review of a particular concept has been conducted, but a particular element of one study was not included in the published systematic reviews, what does one do? Can you conduct another systematic review looking for this element that you find is very important?
Yes, so that's a good point where you find something that, find the review, but if you wanted to do it differently, use a different methodology or add a different things to your Pico question, then you can do that.
Okay, and we have enough. What software to use for statistical data analysis? Do you have any suggestions about that?
Again, in the paper, there's multiple ones that are used there. I think I know one. It's called RevMan, and it's listed in the paper. I can pull the paper now if you'd like, but it's in there.
Yeah. RevMan is one of them, for example, for Cochrane, but there are also many other software. Let me share Systematic Toolbox. It's a community where you can have a lot of tools, a lot of software, and a lot of guidelines there.
Do you want to display that?
Systematic Toolbox, yeah. Systematic Review Toolbox.
Okay, maybe you could put that in chat or one of the questions. Oh, I think we're running out of time and we're a bit over time. Let me see if I get one more creative question. I want to ask, what is the difference between survey paper research, review paper research, and normal paper research?
Is that has to do with, I don't understand the question. Is it using surveys in that, or?
I guess so. I guess so. Yeah. Well, that's that one's a little too ambiguous for us. Difference between, here we are. We'll end with this one. Thank you, Tandi, for adding that. Maybe it can be in one of the slides too. Difference between systematic review and meta-analysis. Maybe that's a good one to end on, okay?
So meta-analysis is the statistical evaluation of the quality of the systematic review. Nowadays, there's pretty much, if you want to design a systematic review, almost all of them have meta-analysis. In the past, there was systematic reviews separate from meta-analysis, but most of the systematic reviews today have a meta-analysis as component of them. So meta-analysis is the statistical part of the review, sorry.
Okay, I think at this point, we're a little over time. I have to say this has been a very complex topic to cover in an hour and 15 minutes, and I appreciate what the two presenters did. I hope that you'll be able to get back to answer any specific questions by looking at the bibliography and the slides that will be made available to everyone. I must say that we have never had as many people attend a webinar as this one. So we really appreciate your interest in this. If I put in my email address in chat, maybe we can come back with some ideas on how we can build on this and what we should further do about systematic reviews and reaching our audience. Okay, so let me put my email address in chat and we can further discuss that. As I said, we're 9 minutes over, and I know we didn't answer all the questions, but I hope this was a good interview, a good presentation, and I know that there are lots of resources that will be in the slides that will be available to you. Would either of the presenters like to make a comment at the end?
This was a pleasure for me. Thank you so much. I'm thrilled to see so many people from so many different countries. It was great.
Okay.
Yeah, I would like to thank everyone for attending in good numbers. Thank you everyone for attending from different countries. Thank you, Lenny, Itoka. I see Dr. Gratian, Messi, and Monica for organizing this, and we are looking forward for another opportunity. Thank you.
Okay, let me close the question and answers. Let me just put my email in chat. So if you have other ideas of where we should go with this or suggest more in-depth training, I'll get back with the two presenters and we'll see what we can do in the future. So here is my email. I just have to hit everyone. Okay. Again, we appreciate your time. We are very impressed by the interest in this, and we hope that we can continue building on this. Thank you very much. Any more
Thank
comments
you.
from the presenters? Thank
Thank
you.
you.
That was it.
Exactly.
Bye-bye.
Bye.